situation had been at long-term care homes until very recently. In an effort to ease capacity pressures at hospitals, the government will begin moving patients to long-term care homes where thousands of beds are available, and they say every bed filled will help hospitals stay functional in the coming weeks.
Long-term care is very safe now.
With the vast majority of long-term care home residents now vaccinated, case numbers and deaths have plummeted. And now the government has made a striking request that homes begin accepting 2 to 3 patients a week to relieve capacity pressures at Ontario's burdened hospitals.
The system is now looking to long-term care to support hospitals.
There are 6,000 empty beds in the long-term care system. The Ministry of Long-Term Care has issued a call to action for homes to do everything they can to safely admit or readmit hospitalized patients waiting for a space in a long-term care home, with the goal of completing at least 1,500 placements across homes in the province over the next 2 weeks.
It's a disaster waiting to happen.
I was really alarmed, actually, when I saw this.
Advocates and doctors are raising major concerns about the plan. They say the long-term care home sector is still vulnerable and in recovery mode, and there remain significant staffing issues at the homes.
Staffing has just been decimated in long-term care homes. We still do not have a minimum staffing standard in our long-term care homes.
Some of these homes have maybe 1 to 2 nurses for the entire home, right? So you are not going to get the quality of care that you get in hospitals, period.
In fact, according to the Ontario Long-Term Care Association, there are fewer staff now than there were in waves 1 and 2, many leaving to work in hospitals or vaccine clinics where help is needed.
It really is a domino effect, which is creating huge pressures on our ability to meet the clinical needs of our residents.
Despite admitting staffing is an issue, they say any patient transfers will be done without compromising the care of current residents. But another glaring problem, the homes with the most vacancies are those that experienced a high volume of outbreaks and losses of life.
You're doing it in the hardest hit homes, which had demonstrated failure during COVID. And I see no evidence that those homes took the appropriate measures to actually improve the care.
It's not about just these beds and the numbers, but it's about the quality of care that people deserve.
The Ministry of Long-Term Care says to keep residents safe, new admissions will not be placed into spaces needed for isolation or into 3rd or 4th beds in ward rooms. The Ontario Long-Term Care Association also wants any patients transferred in to be vaccinated.